In this video I will try to explain minor thalassemia in the simplest terms possible, no medical jargon allowed. Minor thalassemia is a genetic blood disorder that affects how our body produces hemoglobin. Think of hemoglobin as a protein in our red blood cells that helps carry oxygen throughout our body. When someone has minor thalassemia, their body has trouble making enough hemoglobin, or it makes it in a way that's not quite right. It's a bit like having a factory that's supposed to produce perfect little oxygen-carrying packets, but instead, it's producing slightly faulty ones. Individuals with minor thalassemia might not even realize they have it because they often don't show any symptoms at all. However, some people might experience mild anemia, which means they might feel a bit tired or weak. In rare cases, they might have some jaundice, which is when the skin and eyes take on a yellowish tint. The real challenge with minor thalassemia is that people often misunderstand what it is and how it affects those who have it. One common misconception is that minor thalassemia is the same as major thalassemia. But the key difference is that minor thalassemia is generally much milder, and people can lead normal lives with it. Another challenge is that it can be hard to diagnose, especially since it doesn't always cause noticeable symptoms. Despite these challenges, it's essential to understand that minor thalassemia is not a single diagnosis, but rather a range of genetic disorders. Each person's experience with minor thalassemia can vary depending on the specific genetic mutation they have. Minor thalassemia is inherited in an autosomal recessive pattern, which means that a person needs to inherit 2 copies of the mutated gene, one from each parent, to develop the condition. If they inherit only 1 copy, they're a carrier, but they won't show any symptoms themselves. To understand how minor thalassemia differs from major thalassemia, let's compare them. Major thalassemia is a more severe condition that requires regular blood transfusions to manage. It's often diagnosed in infancy or early childhood, and it can cause serious health problems if not treated. In contrast, minor thalassemia usually doesn't require any treatment at all, and it's often diagnosed later in life, if at all. The key to managing minor thalassemia is to have regular checkups with your doctor to monitor your condition and catch any potential problems early. It's also essential to make healthy lifestyle choices, such as eating a balanced diet, getting plenty of rest, and exercising regularly. In addition to regular checkups and healthy habits, people with minor thalassemia should avoid certain medications that can trigger complications. For example, some medications can reduce the production of hemoglobin even further, making anemia worse. By being mindful of these factors, individuals with minor thalassemia can lead active, healthy lives. One final thing to remember is that people with minor thalassemia can still pass it on to their children, even if they don't show any symptoms themselves. This is why genetic counseling is crucial for anyone who has minor thalassemia and is planning to start a family. In summary, minor thalassemia is a genetic blood disorder that affects hemoglobin production. It's often misunderstood, but with the right knowledge and care, people with minor thalassemia can lead normal lives. Remember to stay informed, get regular checkups, and make healthy lifestyle choices to manage your condition. Thanks for watching, and I'd love to hear your thoughts on thalassemia in the comments below. If you want to learn more about related health topics, be sure to check out our other videos.